My name is Dr. Geoffrey Mutuma. I come from the Zambezi Hospital, which is in South Sea in Nairobi. And today we want to talk about one of the conditions which are affecting so many people nowadays. And it is actually a real debilitating disease, and this is arthritis. Arthritis is mainly the inflammation, or it is the joint which becomes very painful, and they become painful at any given time. Arthritis, it is affecting so many people, and so many people are having a problem because of arthritis. And this is a disease which is progressive, and arthritis, it goes with age. And that's why you find that in every part of this country, you find there are people who actually they are working with a problem. They are either they are working with a limp. It means that when somebody is working, you find that actually is limping, or his knees are not good. They are bent. And we have seen so many people, and some people they progress and become so immobilized that they cannot even move. Even some people they are on wheelchair, and there are people working use a walking stick. Others actually they have a problem and they got a lot of pain when they are walking. So arthritis is mainly the sickness of the joints or inflammation of the joints. It is normally common in women because women have got a lot of problems of their joints. And the problem of women, especially for arthritis, normally starts when somebody is around 35 years, because women, they have got low calcium. It's mainly because of childbearing. Their calcium normally goes down. And that's why I found that most of women have got backache, most of women have got knee joint pain or hip joint pain or end pain in one of the joints. What is very important about the arthritis is that there are several types of arthritis, and I would like to go in details about the types of arthritis. The first one is that the commonest is osteoarthritis. Osteo means that the inflammation mainly comes from the bone, and which bones are affected most? The bones which are affected most is actually the knee joint, because knee is one which carries all the weight of the body. The second joint to be affected is the hip joint, which also carries a bit of the weight of the body. And then you've got the back, or the lumbar and the sacral bones in the vertebra, because those are affected by arthritis. And then we have got shoulder joint, we have got ankle joint, we have got other joints can be affected. This mainly by osteoarthritis. Osteoarthritis is a way of saying that it comes with the age. It's normally very common age to age, and that you find that most of the elderly people they have a problem with the walking just because of arthritis. When you've got arthritis, osteoarthritis, that you find that the joints are painful, and it can be one joint or multiple joints. And you find that when the joints are painful, you have to take drugs so that pain can go. And what is very important is that arthritis has no treatment. Treatment is when we say that you can give the drug and the disease is healed. When you got arthritis, the only thing which we do actually we give you drugs to reduce pain, and that's not treatment, because the damage and the damage of the bone goes on as you're getting the treatment for pain. In fact, I normally say that it's better to have pain than to be given something which reduce pain, and then the damage of the body of the bones is going on. And that's why we say that arthritis has no actual treatment. And that's often that for the people who have got arthritis, the disease progresses, and they find that they cannot be able to stand. If the hip joint or a knee joint, they have to use walking stick. If with the backache, the back it is somewhere where it bends. I've seen so many people with a walk and their back is bent because of the arthritis, because their bones become very weak. Now, how do we do to deal with arthritis? Normally, we deal with arthritis by giving supplements, which are normally very important for those who have got arthritis, because the supplements they normally heal and treat the arthritis, so that somebody has no pain and the joint is repaired again, because we normally give a replacement of what is missing in that joint. Remember, when we are giving the treatment, when you are giving the drugs for pain, we are not repairing any bone or any cartilage. But normally, when you give the replacement, that's it, the supplement, the additionals of what is missing in that bone, after 6 months, somebody becomes okay. And that's why for those who have got arthritis, it's always very important they call us so that you can be able to do what you can be able to do, so that actually arthritis is healed. I know, and I'm very sure that most of the people who have got arthritis, actually their disease is always progressive. And many people have remained with a lot of pain. Many people have remained with a lot of debilitating disease, and the people they start they cannot walk. They walk as they use a walking stick. After some time, they start they are put on bed rest or bedridden, and they use wheelchairs because of arthritis. And sometimes the only thing which us doctors can be able to do when you got arthritis is actually to remove that joint and put a metal. It's called joint replacement. It's either knee replacement if the knee be used, or it is hip replacement. We put a metal instead of because the bone has already been eaten out by arthritis or by that effect. And that's why that actually osteoarthritis, common disease, we are finding that almost 40% of the people above 40 years have got arthritis. And as you age, we find that actually almost everybody is around 70 years have got a form of arthritis, because arthritis, a way of saying it, is a degenerative disease. It comes also with age, more common in men than in women. That is mainly osteoarthritis. The other arthritis which is quite common is rheumatoid arthritis. Rheumatoid arthritis is mainly common in children before 18 years, and this is arthritis which comes because of autoimmune disease. Autoimmune disease is a disease which actually is eating each other. It means that the bones they are actually consuming each other, because it's autoimmune disease because of antibodies which are overreacting, and this actually affects in children. And normally rheumatoid arthritis, which is different from osteoarthritis, is that it normally affects small joints. It normally affects the joints of the hand, the joints of the feet, and it progresses to the other joints. But remember, osteoarthritis starts from the big joint, that's the knee joint, hip joint, and vertebra, and then while the osteoarthritis, which is autoimmune common in children, it normally affects the small joints. And that's why children like that, they normally have a lot of problems. The other arthritis, like gout arthritis, this is common for people who take alcohol. For men, mainly take alcohol and eat a lot of namachoma. And they've got gout arthritis, which normally affects one joint, mainly the joints of the big toe, is the most commonest in gout arthritis, which is common men because it's mainly because of high production of uric acid because of taking alcohol and taking beer, and also taking a lot of meat, especially without taking vegetables, without taking fruits. So those are the commonest types of arthritis which we want to talk about today. And I've said, which I'll repeat today, is that the arthritis per se has no treatment, but the supplement. They do normally give very good supplements. And for those who are interested to get the supplement, they'll be able to ring me. I'll be able to give my telephone. And this, we have seen so many people. We have treated so many people and cured. Remember, when you've got arthritis, you don't need admission. You don't even need to come see me. What you need to get the correct supplement for arthritis. And once you take them within a very short time, you'll be able to have those joints be repaired, and you'll be able, if you're walking using a walking stick, you put the walking stick away and you'll be able to walk well. But also, point of caution is that it depends on the extent of the damage of the jaw bone. If the damage is so much, of course, you didn't expect a repair, fully repair. So we expect at least people who have got arthritis to start their treatment as early as possible. At this current time, the drugs which are using mainly three drugs. Mainly, we call it these drugs are mainly from network marketing. These are from BF Suma, which is a very good company, and we have found that these products, the three products which we normally give when somebody is having arthritis, we give it, that arthritis goes for good. And that's why when you take these drugs with the very short time, actually you'll be able to be cured completely of the arthritis. And I've seen so many patients, and fortunately up to this time, I've been doing this for not for a long time, for 6 months now, but I've rarely seen a patient who has been disappointed by those drugs, which that's why I have a lot of confidence with them. And that's why, and it's very important to mention that at least when you got arthritis, get in touch with me. I'll be able to assist to see what I can be able to do, because as I've said, as doctors, the only thing we do is that we give you drugs, maybe a bit of physiotherapy to relieve the pain. And what is very important in arthritis, which is a bone disease, is that you just need to get a replacement. That's mainly supplements. And supplements are three of them. And you can call me to be able to explain more about, or to be able to give the products to you. And my number is 0722 801 299. 0722 801 299. The other one for Airtel is 0734 801 299. Those are my numbers. You can be able to call me, and you have to see us. We are mainly in Zabez Hospital, which is in South Sea, Mayo Road, and we open 24 hours. We both have the outpatient facilities and more of inpatient facilities, and we normally treat all the diseases. But as a hospital, normally we focus on cancers, mainly on cancer awareness, which we normally do cancer work every year, and we are doing cancer work almost in several counties this year, almost 7 counties or 8 counties this year. And we normally screen for cancers. If we've got issue of cancer, we'll be able to screen for cancers, and we also be able to treat for you for cancers. So thank you very much, and I appreciate you are listening and getting in touch with us in our YouTube.